Welcome to this virtual tour of the Blaydon COVID Vaccination Centre. Over the next couple of minutes, we're going to take you on a walking tour of the centre so that you know what to expect when you arrive for your COVID vaccination. The Blaydon Primary Care and Leisure Centre is found on Shibden Road. As you come on site, there is Vaccination Centre car parking clearly marked on the left. If this is full, you can use any of the car parking spaces around, but please make sure that the testing centre is kept clear. As you approach the doors, there are very clear signs. You may need to queue. Please keep 2 meters distance from each other if that is the case. We ask that you arrive within 5 minutes of your appointment time to reduce the need for the queues. When you enter, you'll be directed to a check-in desk on the left through the second set of double doors. You'll be asked for your name, your date of birth, your address, and if you know it, your NHS number. Your NHS number can be found on hospital letters, or for those of you that have the NHS app, on there. The reception staff will then direct you around the corner to speak to one of our clinical staff, a doctor or a nurse usually. It's important that we check that the vaccine is right for you. So your doctor or nurse will ask you if you've got a current fever, had a previous serious allergic reaction, carry an adrenaline auto-injector such as an EpiPen, are you taking part in coronavirus trials, are you pregnant, breastfeeding, or planning a pregnancy. If any of these apply to you, then please speak to the practice before you come for your vaccination. So everything's alright and you can have your vaccine. You'll be asked to walk down the corridor. Please do keep to the left and maintain social distancing at all times. You'll note that the vaccination stations are actually on the corridor, so please come with a short-sleeved top on, ready to have your vaccine. There is no privacy as much as we'd love to be able to provide it. The vaccine itself is usually given into the arm. If you're taking anticoagulant tablets such as warfarin, apixaban or voxaban, or you're on injections such as tinzaparin, then press on the injection site for a couple of minutes to reduce the bruising. It's also worth mentioning that if you're on tablets that reduce your immune system, or you have a reduced immune system, that you can still have the vaccine, but it may not work quite as well. It's worth noting that the vaccine does not contain egg or pork products. After the vaccine, you'll walk back along the corridor where you came from, again keeping to the left and maintaining social distancing, back to the swimming pool area. We invite all our patients to wait for 15 minutes of observation just in case there is a reaction. Serious reactions are exceptionally rare. More common side effects are soreness, redness and swelling at the site of the injection, which can be worse 1 to 2 days after the vaccine, feeling tired, feeling of headache, feeling of general aches, or even mild flu-like symptoms. You cannot catch anything from this vaccine. We invite patients to sit for 15 minutes after the injection. Please take note of the signs on seats or above seats indicating where to sit and where not to sit to maintain social distancing. So that's it. After 15 minutes is up, you'll be directed out of the back of the swimming pool through the changing rooms to exit via the back of the building. For patients where going round the back of the building back to the car park will cause problems, please speak to the marshals who will be able to direct you safely out through the front door. Those who have a flu jab each year will probably recognise this process from their own surgery, but just on a much larger scale. The arrival of the vaccine is very exciting, so let's work together to make this a successful venture. Please arrive on time, wear a short sleeve top, and follow COVID safe rules: mask, space, and wash your hands regularly. And we look forward to welcoming you at the Blaydon Vaccination Centre.